Hi guys, my name's Dan, I'm a veterinarian, and today we're going to cover heartworm disease. Today I want to go over what the disease is, how we prevent, how we treat, and what to expect if your dog does get heartworm disease. You walk in the veterinary office, you're just getting the vaccines done, mind your own business, and they want a heartworm test every single year. Every year, it's crazy. So the reason why is because heartworm disease can easily spread to a dog from a mosquito. So if a mosquito has heartworm disease, or if it doesn't, and it feeds on another dog, and then it flies over to your dog and bites your dog can get heartworm disease that way. And then it takes about 4 to 6 months to get an adult worm in the heart. And once that worm is there, we can test for it and confirm that your dog is positive. What we do as veterinarians is we draw a little blood for that heartworm disease test. And if there is one female adult worm in the heart, she will release antigens and it will become positive. And that tells me there's at least one adult worm in there. So that allows me to diagnose it. So mosquitoes carry everything horrible, I feel like, and they just carry it to your dog and they put it in your dog. Now, if your dog is on a preventative, the shot or the pills, that will prevent your doggy from getting adult worms in the heart. Once that mosquito lands and puts them into your dog, they clean house, so we stay clean of any parasites. And then the other thing is, if we become adults, if we have adult worms in there, that's when we have to treat. Because those adult worms will cause major issues in the cardiovascular and pulmonary systems of your dog, your chest. The chest is going to get really messed up. So if we get a positive, we'll do a couple of things to confirm it. We might put it under a slide to make sure we actually see the worms. We may even send it off to a reference lab to confirm it as well. Once they do that, they will follow a protocol that the Heartworm Association recommends, which is usually a 3-step protocol that is given over, we'll say 2 months, because there's a gap in the middle of a month. But when we do it, we're going to be giving injections into the muscle, and we'll do 3 injections. And those 3 injections will help clean up all the worms. The longer the worms stay there and the more problems they cause, you may still have chronic issues if we don't address it quickly, or if the worms, there's a lot of them and they just cause a lot of inflammation and damage. Because once you kill the worms, the body has to break them down and get them out of there. So even when you have doggies that have heartworm disease, if a pathologist does an autopsy, they're still seeing fragments of dead worms in the lungs. They're seeing scar tissue. The lungs can be kind of beat up. So we test yearly because we want to find it quickly and then want to treat it to give the doggy the best chance of living a very normal life. Because a lot of them, they don't have symptoms but are diagnosed with heartworm disease, do quite well. Thanks for watching, guys. Have a great week.